Okay, I would like to welcome everyone to this month's series of Caring for the Caregiver. Our topic today is helpful ways to manage pain at home, which is so important. We have an expert today with us on pain management and palliative care. Her name is Karen Hall, and she is a master's prepared nurse with many years of experience in and out of the hospital with an emphasis on pain management for over 25 years. In addition to other specialties, including oncology, emergency care, pediatrics, and palliative care. She is our pain and palliative care resource nurse for community hospice, and we're so excited to have her with us today to do this presentation. I will remind you that this presentation will be available on our YouTube channel. So if you go to youtube.com, just type in the community hospice name into that search bar and our channel will come up, and you will see not only this presentation later today, but you'll have resources for all of our previous months, the presentations that were presented. So with that, Karen, how can I forget? Most importantly, I'd like to thank Sutter Health, who is our partner in putting on Caring for the Caregiver. We are just honored to work with our Memorial Medical Center community and help present these resources to the community members in this time and when we're able to meet in person as well. So with that, thank you, Sutter Health, for helping us put this on. And Karen, I'll go ahead and turn it over to you.
Thank you, Kristen. It is my pleasure to be here to talk with you today about sort of my passion, which is pain management. And I think it's so important that Sutter Health does caring for the caregiver. It's as important as the patient that we're helping. So helpful ways to manage pain at home. Let's hope that we can at least give some insight into some things that might be helpful for you. And as Kristen said, I worked in a hospital for a long time, and then I went to community hospice and am still trying to do some of this important work from home. So let's move on to the next slide. Oh, that's me. So I just wanted to focus on how pain is different for everybody. Sometimes it's important to think about why you might choose to go see the doctor. It is the number one reason that people do go see their doctor, wherever the pain might be. And they don't always even refer to it as pain. In the hospital, sometimes patients after surgery, they would say, well, it's sore, I don't really have any pain. So it means different things to different people. They might just call it discomfort. I think it is really important to recognize that and help them, and these pictures kind of help to describe it. One person looks like he's in agony. The other one looks like she may have some discomfort in her head, but it's going to be different for everybody. The psychological effects are also a big factor. Sometimes we're worrying, and because we're worrying, we can't really get a handle on things. Anxiety and depression certainly affect how we take in pain. So I just wanted you to think about that as we go through what we might do about it. The other thing that happens with pain is it can interfere with your life. You may not be able to go to work. You may not be able to do your normal activities or take care of your family or cook dinner. It can really have an impact. So, and this can be all of us. We have all experienced pain of some kind or another. We had surgery, or some other reason that pain was a part of our life. So next slide. So what is it? It can be so many things. And one thing I did not put on here is cancer, and I'll talk about that a little bit at the end. But pain can be caused by all of these things. It can be accidental. There could be some trauma. Something could fall on you. Even a medical condition. Those of you with diabetes are going to experience some pain, numbness, issues with circulation. Maybe you get migraine headaches, and then surgery, orthopedic, abdominal surgery, many other kinds of surgery. We know we're going to have some pain with those. So there's chronic pain and there's acute pain. And acute pain is usually considered pain that goes away as healing takes place. Excuse me. And chronic pain may last beyond the point at which you think it should have healed. And we'll talk a little bit more about what happens with chronic pain. Next slide, please. So talk about your pain. Think about your pain. Think about these elements. Where is it? When I used to meet with patients in the hospital at the request of their doctors, I sat down with them and I said, where is it? What caused it? How long have you had it? Does it come and go, or does it stay? Is it there all the time? What does it feel like? We want to be able to identify it better, because we can treat it better if we can find out exactly what it feels like for you. Is it sharp, dull, aching, burning? You've heard about neuropathic pain. That's pain that's caused by some sort of nerve damage. What makes it better? What makes it worse? Sometimes if you elevate that leg, it's going to feel better. How does it affect your life? Are you able to perform those household duties that I mentioned before and take care of loved ones? And what have you tried in the past that worked? What didn't work? Pain is not just a number. You may get asked by a nurse or a doctor or somebody else in a healthcare environment for you to rate your pain on a scale of 0 to 10. That helps with the intensity. It helps us to know how much it hurts. And your 10 may be my 1, and vice versa. My 1 might be somebody else's 5. And sometimes those numbers are hard for people to identify with. So there are many other ways to assess pain besides using those numbers, but that is a helpful piece of information. Next slide. So then you might think, when should I go to the doctor with these pain complaints? It's definitely not something that we can identify for sure. These are the times you always go, except for things like chest pain. You're not sure if you're having a heart attack. Other kinds of pain that maybe have you thinking that you're having a stroke. Uncertain of the cause, those are times that you might want to go. Uncontrolled effects that can accompany pain. And sometimes you've tried everything, and those home remedies are just not helping. So think about that before you decide to not go. If some of these things seem serious, but it's you and you're going to be fine, so you don't need to get it checked out. Be very careful about that. I'm not giving you an exact list of when you should go, but these are things that you should consider. There are ways to manage some of it at home. There are other things that we can't do much about at home. And that's the main point that I wanted to make with this. Next slide. So what can we do at home? There are a lot of things, dietary considerations even. We know that some of the things that we eat contribute to inflammation in our body, and chronic inflammation can tend to foster or encourage the development of chronic pain. Not all by itself, but it is a consideration. So there are dietary deficiencies there. The immune system can be affected, and I think you can learn a lot from speaking with a dietitian about what you can do to help to minimize inflammation. Over-the-counter medications are other things that we all typically have in our medicine cabinet, acetaminophen or Tylenol, and NSAIDs. The NSAIDs are things like Advil, and all the names are not in my head right this second. Advil, Motrin, naproxen, some of those. Aspirin is also in that category, and we don't all typically take those very often. It's important to remember with acetaminophen and with the NSAIDs that they are not something that you can take lots of all the time either, because there are side effects associated with those, and you need to make sure that you are limiting the amount of those that you take. I used to have patients who believed that Tylenol was safe. You could take it, every 2 hours, a full dose, and you were just fine. And we know now that that's not true. And it is in a lot of things. It's in cold medicines. It's not just a pain medicine. It's sometimes added to other things. And the non-steroidals have some additional side effects. They can cause bleeding in some patients. They can cause kidney failure in some patients. So taking large doses of those may be something that you need to be careful about. They can be very helpful and very useful used appropriately. The prescribed medicines that you may have are opioids, also known as narcotics, and non-opioids. So opioids are things like morphine, which is sort of the gold standard. And we'll talk about that list of meds a little bit more as we go through it. Non-opioids, there are some medicines that were originally developed for a purpose other than pain relief and have been found to have some pain relieving properties. So those are those adjuvant medicines. The non-opioids are the acetaminophen and the NSAIDs and some other ones that do not have the narcotic effect in them. But the adjuvants, I'll give you some specifics for that as well. Next slide. So what can we do besides medicines? There are a lot of things that can really be very helpful. If you've had some sort of injury, sprained ankle, fell, broke something, ice can be very helpful. Applying cold to an immediate injury, say you fell down, hurt your knee, you want to elevate that knee and put ice on it. And then after a couple of days with ice, you may want to go over to heat. But initially, the cold will help with the swelling. And so that is not the time that you would want to put heat on there. Massage, we know that can be very helpful. You can imagine when your neck hurts, that sometimes having a massage helps with that discomfort. Same thing with physical therapy. There are many times that after a total joint replacement, for example, that a major part of your recovery is physical therapy. So we don't want to only rely on medicines when there are a list of, this is only a partial list of things that you can do to help with pain. And some of these are now not considered sort of alternative treatments. They're considered main treatments for the treatment of pain, and some of it will be covered by your insurance as well. Even the acupuncture and yoga. I heard an expert recently talk about those and how some insurance companies are now starting to pay for some of that. And the opioid crisis in our country has made everybody look at all of this again. So, and even, meditation and distraction. I always think about my favorite I Love Lucy show and the Vitamita Benjamin when I think about distraction, because it takes your mind off of it, maybe for only a short time. In the hospital, when I used to care for patients, and they seemed to be pretty happy when they had visitors and they were, sort of entertained and distracted. And as soon as those visitors left, those people, their pain was their focus again. So distraction isn't a cure-all, but it can be helpful for short term. So sometimes we all need to use those kinds of approaches. Next slide. So the opioids that I was talking about, these are the main ones that you hear about. Morphine, that's the one that all other opioids are sort of measured against to compare strength. And somebody put a point in there about pet therapy and music therapy. There's a list of things that can really be helpful for helping with pain. But back to the medicines. Morphine is the one that all the others are sort of compared to in terms of strength. It's the gold standard. And then Dilaudid is a medicine that we give a lot of in the hospital postoperatively. It's usually given IV, but it's also available orally. Hydrocodone may be the one that you are all the most familiar with, Vicodin, Lortab. And you have to remember that this medicine is usually combined with some acetaminophen, not always. Oxycodone, the OxyContin is the one that kind of people know about. It is the long-acting version of oxycodone, and it comes in a short-acting form as well. It can be very effective when it's appropriately used. All of these medicines can be used appropriately, especially for short-term. What tends to happen is these medicines are ordered initially, maybe after surgery or after you leave the hospital or after you leave the emergency room, and you may only have a few days worth, and then your pain continues after that. And sometimes we get into trouble when the patient is not fully assessed, not fully spoken with about how the pain is and what else we can do. And sometimes those medicines may be reordered on a regular basis when maybe there are other things that we can do. I put codeine on this list. It's still available, not as commonly used as it used to be. It's very mild. It's also very constipating. And there are several other opioid analgesics that could go on this list, including methadone and some other things that we weren't going to talk about today, but they all sort of fall into this category. Next slide. The side effects of the opioids are basically these. Very common to have itching when you first start taking an opioid medication. It's maybe something your body has never experienced. So it's not really considered a allergic effect. It's just a normal side effect of taking that medicine. And generally, if people take opioids on a chronic basis, on a long-term basis, that itching goes away. The nausea and vomiting is also fairly common if it's a new medicine for you. The things we worry about the most are the sedation and the respiratory depression or slowed breathing. With these medicines, you're going to have sedation before you have that slowed breathing. So we want to make sure we're keeping an eye on people who are taking this medicine and get very sleepy. Sometimes we might want to back off or take less. Respiratory depression is what happens when people get too much. And you've heard of people getting Narcan if they get a respiratory depression. You may have heard about that police officer recently who was exposed to an opioid just by touching it. And he had to have Narcan given to save his life, basically. So these medicines can be very helpful and they can be very dangerous if we're not using them appropriately. Constipation is an important side effect. It almost always happens for people who are taking opioids. And if you start to take opioids, even short term, if you had a surgery and you're only going to be on the opioids for a week, you want to take a stool softener to help prevent that constipation, because that just adds to your discomfort. And it doesn't go away like the other side effects tend to. All of them, after a period of time, the side effects will go away, except the constipation does not. So taking a stool softener or managing that is an important thing to remember. Okay, next. Again, the non-opioids, as I said, do have some side effects that we need to pay attention to. Pay attention to these effects, the allergies, the interactions with other medicines that you may take. So you want to make sure that you know what's in those medicines that you're using. We've talked about the acetaminophen and the NSAIDs quite a bit already. There's also local anesthetic that can be used, like a cream that can be helpful. If you are having, if you have like a burning sensation in your skin or those kinds of things, there is a local anesthetic cream. They also use it before they start IVs sometimes, or before they insert a tube. So besides the injectable kind that you may have from the dentist, we know there are lots of other ways to use local anesthetics in terms of, you might have a nerve block or those kinds of things that can help with pain. Antidepressants and anticonvulsants are also medicines that are used. These are a couple of the adjuvants that I mentioned that were originally developed for other purposes and have been found to have some pain relieving properties. So you may, if you are antidepressant, you may find that your pain is better too, depending on what is causing your pain. So even, and you've heard of, sciatica. You may, these medicines may be given because you have pressure on that sciatic nerve. And other medicines that fall into these categories, excuse me, gabapentin and clonazepam, those medicines may be also prescribed for neuropathic pain. Next. I wanted to mention this just because it's in the news all the time. Why is drug education important? That's why I'm glad you're here today, and I would like to share this information with everybody. It is very important that you understand how drugs work. Your body has these sensors, basically, where the drug goes to and sits, and then when it's used it up, it's not there, and then your body may want more. So it's very interesting to learn that before about 1990, physicians didn't order opioids for people who didn't have cancer pain. Usually you might get a little bit following a surgery, but otherwise it was very uncommon for opioids to be prescribed for patients. And then by about 1999, 86% of people having surgery or other kinds of pain, you went to your doctor because you had a backache. Low back pain is a problem that's been studied and researched many times. And it's one of those things that's really hard to treat. And with medicines, you just keep taking more medicine and more medicine and more medicine, and that low back pain doesn't go away. So that might be where we want to look at some physical therapy, heat, cold, some of those other applications. But after 1990, it just started going crazy for patients with non-cancer pain. So like I said, by 1999, 86% of people were being prescribed these medicines. So it's no wonder that we're sort of in the crisis that we're in now. So that's why it's really important for you to understand what is going on with pain and pain management, and taking a look at everything you possibly can besides opioids. My concern with all of this, however, as a pain management nurse, is that patients with severe pain are not getting what they need. So, and I know that some people in the community have had a difficult time getting medicines when they need them. There are laws in place that prevent doctors from ordering larger numbers of pills, and pharmacists are limited in what they can stock in their pharmacies. It's a huge problem. It's not something that we can overcome today, but it's certainly something that we need to be aware of. And you need to have a conversation with your doctor or your nurse practitioner or your physician's assistant, whoever is treating your pain or helping you to treat your pain. You really need to talk about what the pain is all about. Where is it, as I said before? How long have you had it? What have you done about it? Is it there all the time? Does it come and go? So there are tendencies in families that we know that sometimes drug use and drug abuse can run in families. And if people are typically drinking alcohol along with taking their opioids, that's obviously going to cause all kinds of additional problems. So I just really encourage people to be informed and to really take a look at what's causing their pain, and don't just count on the medicines. You may all have family members who have had issues. It's just something to learn more about. Next slide. One thing that I recently realized is that emergency room visits have really increased because patients cannot get pain meds from their doctors. So they go to the emergency room and maybe they get 5 days worth, and they stretch it out. They don't have really enough to last 2 weeks, but they'll stretch it out for 2 weeks, and then they'll go back to the emergency room and get another one. The problem with that is also cancer patients are making more emergency room visits because they cannot get enough of their pain medicine to manage their pain. And I don't want to I don't want to make everybody think about the negative right now, but just be aware that there is a problem with dealing with both sides. So if we can find a way besides using medicines to manage pain, I would really encourage that. And now I'd just like to take any questions that you might have.
I have a question. This is Teresa.
Teresa.
What are some anti-inflammatory foods that can help?
Oh, well, that's why I really encourage you to go to talk with a dietitian. But the Mediterranean diet is known for sure to be less inflammatory. Things like tomatoes are things we should avoid if you're talking about inflammation. So just looking at that Mediterranean diet can really make a difference. Whole fruits, nuts, vegetables, there are some that we want to avoid because they increase inflammation, but mostly not. And if you look at that Mediterranean diet, you know, the avocados and some of those other flaxseed oil.
Thank you.
Sure.
Are there any other questions or comments at this time for Karen?
Well, I thought this was an excellent presentation, very concise and complete. You did a great job. Thank you so much.
Teresa, thank you for sharing. Okay, if there are no further questions or comments for Karen, first I'd like to thank you, Karen, for taking the time out of your day to join us and share your expertise and your passion with us. We really do appreciate that. I also would like to invite everyone to join us for our next Caring for the Caregiver presentation, which will be held next month. The topic is preparing for sudden emergencies. That will be on September the 9th at 11 a.m. You can use the same link that you used today to join us. And with that, if there are no questions or comments, I wish you all well. Please stay healthy and safe. And Karen, thank you so much again.
Thank you.
Thank you, Kristen.
Oh, you're welcome. My pleasure.